I'm Dr. Robert Mitchell. I'm the Medical Director for Kraft Medical. I'm going to answer some of your questions regarding being on testosterone therapy. Determining if a patient is a good candidate for testosterone replacement therapy, we use a blood test to determine what that testosterone level is, and that's obtained from a blood draw. The patient is sent to a lab nearest where they live. That blood is drawn, and we usually have results back in about 2 days. Frequently, when patients see me, they inform me that they have symptoms of low testosterone, but went to their personal primary care physician, and that physician has told them that they have testosterone levels that are considered to be normal. We disagree. We believe that there's an optimal range of testosterone based on the patient's activity, their lifestyle, and so we use what we consider as an optimal level, not what's considered normal based on a lab. I advise my patients, whether they're on testosterone injection or they're on the dissolving tablets, that this is a medication that, as all medications, should be kept out of reach of children, but also informing your wife is that this medication is testosterone. And so just to avoid any transference or someone taking a dissolving tablet thinking that it is a benign medication, it is a testosterone hormone, so I advise my patients to keep it in a safe place. A frequent question that I receive from a patient is, I'm currently on supplements to help boost my testosterone or my sports performance. Should I stop that supplement program? I don't advise against taking those supplements. With frequent lab monitoring, if something arises that is an issue, we might advise you to stop taking certain supplements. For other patients, they're concerned about their current medication regimen. This might be medication for high blood pressure or high cholesterol. Being on testosterone replacement therapy does not interfere with those medications, and we advise that you could continue to take all medications that you were currently on. At Kraft Medical, when we determine if a patient is a candidate for testosterone therapy, that patient will meet with me, a physician, or another physician to determine, based on their labs and their symptomology, if they're a good candidate for testosterone replacement therapy. This is repeated quarterly for the first year. After the first year, depending on the patient's symptoms or concerns, they will meet with a physician at least twice a year or more frequently, meaning that if a patient determines in their treatment and therapy that they have a question and they would like to revisit with the physician, that is always available. So when evaluating a patient for testosterone replacement therapy, we're looking at testosterone level. We're also looking at the patient's estrogen level, their PSA, which is a measure of their prostate health, and hematocrit, which is their percentage of red blood cells. Those labs are repeated quarterly, and those labs are reviewed by your physician and discussed with you, the patient.